Okay, welcome again everyone. This is Dr. Marge Riley from the CUNY School of Professional Studies Nursing Program. I'm very pleased to present our speaker for today's webinar. The topic is Informatics in a Connected Healthcare Environment. And our speaker is Dr. Diane Skiba. She is a professor and the specialty director for healthcare informatics at the University of Colorado College of Nursing. Over her career, she's managed numerous grants to prepare the nursing workforce. These included a university-based training grant of $2.6 million funded by the Office of the National Coordinator of Health Information Technology to prepare healthcare professionals for highly specialized health IT roles. She is a fellow in the American College of Medical Informatics and an honorary fellow in the American Academy of Nursing and the Academy of Nursing Education. She is AMIA's U.S. representative in nursing informatics and the vice chair of country membership for the International Medical Informatics Association, the Nursing Informatics Special Interest Group. She's also a member of the NI 2016 Scientific Program Committee and the chair of the NI 2016 Student Design Competition. Welcome, Dr. Skiba. We look forward to hearing your presentation today.
Thank you so much, Dr. Riley, and I want to thank everybody who is attending. I know you have busy schedules, so I appreciate you taking some time out of your busy day to hear about informatics in a connected health environment. As Marge said, I've been around for a while in informatics, and I have thoroughly enjoyed preparing people for informatics roles as well as preparing nurses to be able to interact in our ever-growing connected world. So today we're going to talk about that connected world. We're going to describe the concept of connected care. We're going to talk about some of the digital tools that are out there and what people are using, and also sort of what is the informatics role in preparing nurses for a connected care age. So before I start, I'd like you to think about sort of how connected you are. If you're pretty typical, you're going to have probably a lot of connections, and I would like you just to take a little bit of time to think about how many of you have a smartphone with a Wi-Fi connection. Do you also have maybe a tablet? Do you have some kind of tracking device like a Fitbit or, you know, an Apple Watch or any of those things? When you think about your environment at home, do you have any devices that are connected at home, like security systems, washing machines, different kinds of things? I have an app for my washing machine so that if I would only remember to put the clothes in there, I could actually turn it on using my mobile app. Do you have any connections when you're in the car? Do you have any health devices that may be connected? So if you total those up, how many objects do you think you have? What we're seeing and what the literature is talking about is that the majority of the people that are in this new age have anywhere from 3 to 4. There's also a percentage of people who are over 5, and I think we're going to see that grow over time. Nielsen, who many of you may know as the ones that used to do the television ratings and who watched what, are now monitoring things like how many people are connected with different kinds of objects, and they talk about a connected life. And as you can see in this timeline, a lot has happened over the last 5 years. You know, when in the beginning, you know, in those first 50 years, we were kind of in this broadcast. We used to have things like early cell phones, and we got our MP3 players that we used to use. And now you sort of see this growth where we've got smartphones, where we've got connected devices, tablets, we have mobile shopping and banking, our cars have now connectivity, and we now have things called wearable devices. devices. So it is all part of this connected age. The Association of International Electronical Engineers talk about it as the Internet of Things. And what they mean by that is the number of physical objects that can be connected to the Internet. And they believe by the year 2020, we will have reached or exceeded 50 billion connections of things. So I think that's really sort of fascinating that we've got this. They're also talking about at least this many vehicles will be connected to the Internet. I don't know if any of you have seen the commercial. This has just recently come out in the Denver area where they talk about the smart refrigerator. This is part of the Internet of Things where in this particular case, this Samsung refrigerator actually has a panel on it. You can leave messages, you can connect with it, you can actually view by having cameras inside your refrigerator, sort of the dates of like your milk carton to see if it's expiring and you need to pick up milk, and you can see the objects in your refrigerator so you know what to purchase when you're at the grocery store. It also can connect with your Fitbit in the future. You know, my vision is the refrigerator in the future will be my health coach. So every time I open it, it will tell me whether or not I've run enough to actually deserve to take that stick of ice cream out to eat. Healthcare is not immune to this. We have a lot of objects that are becoming a part of the Internet of Things in healthcare. And we're starting to see this just explode in the last year or so, and I think there's going to be even more of a continued growth in this. So when I think about the Internet of Things and I think about the connectedness of things, the Internet of Things really talks to and speaks to connections with physical objects, whereas the connected age and how we interact as humans in it is more about those virtual connections, you know, especially with people, resources, and ideas. And we're going to talk a little bit more about that. Diane Oblinger had a great quote that I really thought sort of brings out what this whole notion of connectedness is. And connecting is all about reaching out and bringing people together, about building that synergies to create a whole that is better than the sum of its parts. It's a really powerful metaphor. Everyone and everything is connected. People, resources, data, ideas are all interconnected by being linked, tagged, tweeted, text, followed, and friended. And I'm sure many of you utilize these different techniques to stay connected. When we think about it in terms of the healthcare arena, there's a couple of different definitions that are out there that talk about connected health. And connected health, according to Caulfield and Donnelly, is a conceptual model for health management where devices, services, and interventions are designed around the patient's needs, and that the health-related data is shared in such a way that the patient can receive care in the most proactive and efficient way. And we're starting to see more and more people utilize the terminology. Connected care takes patients, caretakers, and provided and connect them so that they really can get that information and understand the patient's status at any point in time through the use of these different connected devices and platforms. The VA system has now begun to start thinking about calling their telehealth projects and anything that they do that connects patients and providers as connected health within their system. I like to think of it as connected care, and that really kind of blends the high-tech portion of the Internet of Things along with the high-touch connections that we get when we're using a lot of the tools that facilitates those interactions between patients with their providers or caretakers with their patients' providers, or it's between patients and patients interacting and talking with each other and sharing ideas about how they are. Connected care is really just an ecosystem that provides the collaborative care team, which is your team that you as a patient have, that might include a nurse, a physician, a pharmacist, whatever, in new ways to the healthcare system so that people can share experiences, content that can be part of communities and resources. And that ecosystem is to provide connections between providers to providers, providers to patients, and patients to patients. It is really about utilizing a lot of these different digital tools that we have, and thinking about care as not just being inside a healthcare system, but outside of the walls of a healthcare system. So it's all of these wireless connections that patients and providers can have, as well as their families and caregivers, to really help manage and participate in a patient's health. Those digital tools might be things like sensors, it could be mobile apps, it could be connecting through Facebook, social support groups, patient portals, this whole idea of connecting to patients with each other through a variety of different e-patient platforms, as well as what you see, PGHD, which is patient-generated health data, like the data that's collected off of Fitbits or heart monitors or whatever. So as you can see, connected care is really about putting that patient in the center and really having the community and all the resources out there, whether it's primary care or acute care or just living well, along with community care, all being interconnected and helping to facilitate that patient in wellness as well as in sickness. It's really transforming patient care to become consumer-centric. I know we've talked a lot about that over time. I know that in nursing we consider that we are patient advocates and we see the patient as the center of care, but it is now realistic to incorporate them and have them be an active member of a care team with them in the center of their care. And as we look at where nursing is going, there was a great article that came out last year about nursing in a transformed healthcare system. And as you know, we are rethinking healthcare and how it's delivered. There's more care coordination, more transitional care that we need to look at. The hospital is not the only place where people get care, and that we need to have nurses that have skill sets that really deal with what we're calling a continuous learning health system. And a continuous learning health system means that we are taking the clinical data and the evidence-based practices that we have already in place, and we're taking that clinical data and feeding it in to begin to generate new evidence so that we can provide the best care at the lowest cost for all people in terms of a healthcare system. Nurses need to be able to not only know how to coordinate, care and help with transitional care, but they have to learn how to use data and evidence from their EHR so that they can optimize their care. They're also going to have to be part of interprofessional teams and be able to collaborate, including that patient and their family within the team, and actively engage in performance improvement projects throughout. Nursing in a transformed healthcare system will also take into account telehealth systems, allowing the healthcare providers to remotely monitor and communicate with patients so that it provides a more convenient as well as a safety net for patients once they are either discharged from a hospital or after they're seen in a clinic. And we really want nurses of the future to have effective use of health information and these systems that really are considered essential parts of having a successful care coordination project. There's also sort of this whole movement afoot that's about consumer engagement. And there is a lot happening about really as we move to a consumer-centric model, making sure that we engage the patient. I love this quote from Leonard Kish, who said, if patient engagement were a drug, it would be the blockbuster drug of the century and malpractice not to use it. I think what we're seeing from federal initiatives as well as initiatives in hospitals and in clinics is the more that we can engage a patient and have them be active participants in their care, the more likely it is they'll be able to improve their health and health care. And so the federal government a couple of years ago started with what they called the 3 A's to really engage people to improve their health care through using health information technologies. And the 3 prongs of this strategy include giving them access to their health care information, like to their health care records, giving them access to patient portals, enabling them to take action with that information and to help have them be part of the decision-making process, as well as helping to facilitate the attitude so that patients and providers begin to think of themselves and act as partners in managing care. And it's been interesting to look at the research. As the patient and the consumer people move more into being empowered and start engaging, we still have a little bit of a lag in getting those providers, particularly our friends, the physicians, to think of the patient as a partner in their health care and allowing them to be much more engaged in this. As you can see, there's a lot of writing and a lot of thing about patient as a partner in their health care and making them have that accessible information so that they can have shared and informed decision making. And this is by the Institute of Medicine, who really believes that if we do not partner with patients, we will not be able to fulfill the dreams of the triple aim of better health, better care at lower costs for all of our patients. It's even impacting the way we think about research and how we think about patients being much more part of the research agenda and how important we need to begin to think about the science of patient input and how we really can facilitate that to the point where they can become not just a passenger but a co-pilot in terms of the research endeavors that we are trying to do. Eric Topol is a cardiologist who has been involved in health information technology for a long time. And in 2015, he wrote a book called The Patient Will See You Now. And he kind of uses this quote to get you to think about all the options patients have right now. And his quote is, "It takes 2.6 weeks to get an appointment with a primary care doctor on the average. Since it's so hard to see a doctor, what is really interesting in contrast is that everybody else will see you now. The crowd, meaning maybe if you're on a Facebook group, will see you now. The patients, other patients that you might connect with will see you now. Dr. Google will see you now. The robot, the avatar, everybody will see you now but the doctor." And I think we have to start thinking about how we can better incorporate within this interprofessional care model how you bring that patient in as part of the team member and begin to utilize some of the digital technologies to do that. As you can see from this picture, more and more people are connected. And as those people become more comfortable with the technology, even from the youngest all the way to the oldest, they want to engage in finding out more about what will keep them healthy as well as what will get them to get better if they have certain kinds of conditions. And particularly with our high populations of those with chronic disease, we need to help people to better manage those chronic diseases and begin to lead healthier lifestyles. The American Well organization did a survey of consumers, and this is a link to their particular survey and the results of it. And they found that most employers wanted to be able to offer telehealth services to their patients. 32% were already offering them, and when I mean telehealth, I mean that patients can actually connect with their providers using their smartphone, using a tablet, or coming in through their laptop or their desktop computers and have a virtual visit with their patient. They also found out that 77% of the employers were really looking at how to be able to offer that and how many were planning to offer those in the upcoming year. You can also see that users are beginning to go and find their own apps, and that we find that a lot of healthcare providers, although they're using apps, they haven't yet gotten to the point of recommending apps for their patients. And this is something that's got to increase. We've got to make sure that providers are knowledgeable about mobile apps and know how to evaluate and make recommendations to their patients about what apps might be the most useful for them. And I think providers are still a little reluctant to do that, and we as educators must begin to educate our populations to understand how to do that. Because I will tell you, the patients go out and find it themselves. And they might not have the skill sets to really evaluate whether or not those are good mobile apps. Here's some of the reasons why people use mobile apps and why patients are particularly using it. A lot is for tracking their goals that they might set, let's say fitness goals. They want to be aware of health issues. Some of them use them as motivation. If any of you are on Fitbit, you know how you get your little badges and you can join groups and you can compete with groups to see who can walk the most steps. Many use it for medication, or some use it for medication adherence, connecting with experts, and I think you're going to start seeing that those will start to increase as more and more providers and healthcare systems begin to push the use of mobile health. When the Pew Foundation, who has been studying the internet, has looked at this and surveyed everyday people to see how likely they would use mobile apps or mobile health apps, what they have found is that 85% of the adult population have access to a cell phone, with 55% of them having a smartphone. Now, this was back in 2012, so you can imagine that we've probably increased in the number of people who have access to cell phones, as well as those who now have smartphones. The most likely people to use mobile health from their particular survey that they had were 18 to 48-year-olds that were Latino, African American, and many had college degrees. So you can see that population. There are a lot of mobile apps that are becoming accessible. Hospitals will provide their own mobile apps. There are different organizations, like here's some examples from the VA for some mobile apps that you can get that patients can use, as well as you as a nurse might be able to use. They actually have, the VA has an app store. Some of the applications are for patients, and you don't have to be a VA patient. Some of the applications are targeted towards staff, so there might be some mobile apps that would help a staff nurse. Others are truly oriented towards the patient, and all are freely accessible. The government has also sponsored a lot of development of apps that they want to make available to the public. So as you can see, if you go onto this particular website from the government, there are some apps that you can recommend that look at PTSD, how to quit smoking. There's a BMI calculator. There's things that are for asthmatics, as well as the last one is to solve an outbreak by the CDC, is really targeted to healthcare professionals to see if they understand how to sort of look at epidemiology and some things to determine an outbreak. What we're also seeing happening with these digital tools is that more and more people are starting to get access to what the government calls consumer-facing tools. That's a term that the Institute of Medicine and the federal government has started to do that talks about the access that people have. From an informatics perspective, there is a push from the federal government that if you have an EHR, that your patients should be able to access that EHR. And they should be able to get access to their health record for a variety of things, or to a health portal. So here's an example of my health connection, which is my portal. And as you can see, I can go in and do a lot of things, including sending messages. I get all my lab results. I get a lot of my results from other tests that come back almost immediately. As a matter of fact, one of my physicians that I see, he doesn't even bother looking at the results of my blood test till he comes in the room, because he knows I'm sitting there with my iPad and I have the results at the same time he does. So he comes in and looks at the results with me, and we start to look at things. You can also get access to all your health summaries when you have a visit or when you're in the hospital. You can get information from, in our case, we have access to the Get Well Health Network, so that if I click on a particular diagnosis, I can go out and get information about that particular diagnosis. What you're also seeing in hospitals is that they are beginning to use these tools in the hospital setting. They are providing different tools that the patients can use while they are in the hospital, or it might be their family members to use while in the hospital. This happens to be an example of a study that was recently done at Brigham and Women's Hospital. and they have developed a patient-facing tool. It's part of a toolkit that they use with all inpatients. So as you can see, patients get a tablet when they come in, and that can be used by the patient or maybe their family members or who might ever be their caretaker. They get to see pictures of who's on their team and what roles they play. They get to see the goals that the particular care team has set for them. They also get to add their own goals that they would like to achieve as they're in the hospital. And all of these things are then accessible to all the providers as well as to the patient and his family. So when lab tests come back, they have access to that. They can see how far they are on the goals. It's really brought that patient into the decision-making process. It's kept them informed. They can learn about things. They can get access to information to better understand the drugs that they might be taking or the procedures they may be having. They can access their team at any point in time. And one of the things that they discovered was that by having this information easily accessible to not only the patient but the whole team, it got concordance across the providers in terms of the goals that they were setting for a particular patient, and including the patient's preferences for certain goals and activities. When we think of a connected health, we can also think about how we can provide people that may be in different states of wellness or illness and provide them access to healthcare information and to make connections. I was recently in the fall down at the Tampa VA, and I was working with some of the informatics nurses, and they were showing me the kinds of things that they were doing at the spinal cord injury center to include these patients and to get them to be part of the healthcare team. So this is just a snapshot from that video, but the video is in the previous slide. And here is a patient who is a spinal cord patient who is actually connected up through what they call a sip and puff. So this sip and puff allows them to interact with what they call a quad-joy thing that then connects to the computer. So here this particular patient can use some of the entertainment by playing chess, and can also sort of stay involved with their health care. They can ask questions, they can go read stuff, they can stay in contact with the outside world utilizing these tools. And these are all done through these assistive devices to keep them connected with their health as well as connected to the people that might be worried about them. I think we're going to see more and more of these kinds of connected care visits, and we're going to see that virtual patient visits are going to become more and more important, particularly as we try to manage the growing number of seniors. I happen to be a member of AARP, being old, and there's lots of things that they're talking about to really encourage their membership to become very active in their health care and to begin to use different tools. They mention in their articles, and almost on a regular basis, about health apps, about signing up for your patient portal, asking about disease monitoring. getting connected into what they call crowdsourcing, or things like websites like Patients Like Me, so you can talk to other patients that may have your diagnosis. How you could use this to help stroke victims, fitness devices, how to set up to have virtual meetings with your doctor or clinician, virtual counseling sessions, and how can you provide in-house video conferencing. The VA has been very, very aggressive with this in providing virtual visits. Their virtual visits kind of started off with you going to a provider and having it from provider to provider. Then they started doing clinical visits that were really focused on home monitoring, and this is an area where they see is going to be their greatest growth, in having their patients set up to be able to be monitored at home and have video visits. For many of you on the East Coast, you probably know of CVS, and that they have minute clinics that are really managed primarily through nurse practitioners. Well, they have announced that they have formed relationships with 3 different companies, so that they're now going to be able to do virtual visits. So you don't even have to now drive to the CVS. You can actually do a virtual visit. United Healthcare also has this set up. If you've never seen their video, this is a great little video where you can see people at home and a little accident that occurs and how they connect with their physician after the accident from their house. Again, you know, we're thinking and having to think about how do we prepare the next generation of nurses and nurse practitioners in particular, who are going to be engaging with their patients, whether it's a primary care visit or it's monitoring a discharged patient through video connections. So here's just some pictures of equipment that we actually purchased off of Amazon to be able to use at home for patients to monitor their blood pressure. They can monitor their blood pressure. You can get a digital stethoscope. You can get a digital weight scale. You can get a pulse oximeter, as well as, I said, the blood pressure cuff. All things that we purchased off of Amazon.com, and are able to sort of give it to our patients, and then we can monitor our patients. We've actually begun to train our nurses how to do a virtual visit. And here's a nursing team which included the patient is our 74-year-old patient up here on the top, and then one is a nurse and one is a pharmacist who meets with this patient as a follow-up visit to coordinate his care in his home. I think we're also going to see a big game changer that's happening as we move from sort of just having things on your phone or your tablet, as we move to smartwatches. And the smartwatch, you know, is now having different platforms on it that are really allowing that we can collect patient-generated data and begin to kind of allow patients to interact. Cerner and Epic, which are huge systems, have developed patient portals that access through the Health Kit, which then connects to the Apple Watch. And we're going to see this for any of the different kinds of smart watches. Humana has done a thing so that they can connect with the smart watches to actually have their patients share data, like from their Fitbit. Stanford Hospital has it going through an iPod touchscreen, where their children that have type 1 diabetes can interact and store data and communicate back and forth through the Epic system with their providers. I think we need to think about the fact that these watches that are coming out are more than just data collectors. They really can become a dashboard. And that what we're going to see is that we're going to have patients who are going to be able to kind of view where they're going and what's happening with their health care by visually just looking at their watch. You won't have to even sign into a computer or a tablet. You're just going to be able to look at your watch. So many believe that this is going to be a really transformative opportunity, that we can really begin to bring that patient and their data into our ecosystem so that we can better utilize that information to provide the best care and at a lower cost to our providers. Think about this as a game changer, particularly for maybe people who are elderly and might not want to use a computer. Maybe they want to be able to just, do something that's familiar to them. Well, a watch is pretty familiar to everybody. People can understand that. And imagine that you would send home a patient with chronic heart failure with their Apple Watch, a digital scale, some other things, and if you could do that and send that home and spend that slight investment, you could probably save lots of money to stop readmissions within a 30-day cycle. And I think, people are much more comfortable if they had a watch that would remind them of when it's time to take a particular drug, or how they can step on the digital scale and it would talk to their watch and send their weight gain for that day to their provider. These are all things that are considered part of the connected health environment. So what I want to do in this very end, before we open up for questions, which I forgot to tell you, if you had questions, you could write them and click on the question box and we'll take questions at the end. I want to tell you what we see as the informatics specialist role. As you know, I coordinate a program in informatics at the master's level, and what we are trying to do in our particular program is to make sure that our specialists, when they leave our program, have knowledge and skills of digital tools for connected health, because we want them to really work not only with consumers but with the staff. We want them to help educate and give them opportunities so that they can become more comfortable with digital tools that their patients might be using, as well as how they can use digital tools with their patients. We also want our informatics specialists to really help work on the design of these interfaces. The older you get, the harder it is to read. So, making sure that you can increase the font sizes, making sure that there's some consistency with how we design an interface is all the roles of what informatics nurse specialists do. And they work with their clinical partners. They work with the staff as well as the IT people to say, oh, well, if we're going to put together this patient portal, here are the things that we need to be considering when we look at that interface between the human and the technology. We also want those informatics specialists to be thinking about what are the positive and negative consequences of all of this. Initially, when there was a lot of things happening around staff communication and using the EHR as a mechanism for communication, we found that some of these communications dropped off, and that the nurses weren't talking to the physicians and the physicians weren't talking to the nurses, and sometimes valuable information was not exchanged as it had been in the past. So we need to be thinking about what's going to be the positive consequence as we live in this ecosystem of connected care and of patients, being part of that care, and how do we really incorporate them in there but make sure that they do no harm. Informatics specialists really need to also work with how do we promote and engage consumers. What we have found in the research that places that have a lot of consumer engagement really have a lot of providers who understand and utilize a lot of the digital tools that then they can promote that with the consumers, and that there are people that are available to help consumers. You know, it's one thing to hand them a brochure, it's another thing to sit them down while they're in the waiting room waiting to see their clinician and helping them log in and showing them how they might engage in their health care. Informatics specialists also are going to be key in developing health campaigns to promote that usage, whether it's for the provider or whether it's for the consumer, and that they need to have those knowledge and skills. We need to not think about everything just being on paper, but how do we use this connected care to get health campaigns out? How do we start to, say, utilize, you know, Twitter and these different tools to inform people about drug recalls, or maybe inform people about making sure they get their flu vaccines, or making sure that if they travel to the Olympics that they're aware of the Zika virus. The other thing that, you know, we are really providing for our informatics specialists and promoting that they do is that they become part of these connected care teams. You know, it's important as we look at interprofessional care and as we look to bring the doctors, the nurses, the pharmacists, the social workers, whoever as part of the team, we need to be thinking about how we bring that informatics specialist in there too, who can help us better use the technology to really promote better health, better care at lower costs. I also want you to think about your role in connected care as a nurse and the kinds of things that you need to be involved in. I happen to have read Topple's book many years ago, and I started to rethink about some of the things that he talked about. And he had a commencement speech that he gave to new physician grads, and he had 5 questions that he asked them. And I thought, well, I'm going to steal that idea and I'm going to talk about some of the questions that I would pose to current graduates to get them to understand that we need to be getting them engaged in this connected care environment. So here are some of the questions for you to think about. Will you and the care team include me as the patient as an active partner in your team? Will you and the care team advocate for patient-generated health data being a part of the decision making so that I can choose the right digital tools to capture that data that's most relevant to my health condition? Will you and the care team be supportive of my family or caregivers being actively and maximally engaged in my care? Will you and the care team share your clinical notes with me? This has always been an issue, and this has been something that's been very difficult for staff to think about sharing their clinical notes with patients. But there's a movement about things called open notes that more and more healthcare facilities are putting in place, where clinical notes are being shared with the patients and their providers. So that's something you'll start to see more and more in the future. Will you and the team leverage numerous forms of data to inform my clinical decision making? Let me give you a perfect example of that. If you're a diabetic patient and you go in for your quarterly visits, if your provider only sees the lab results for the day of the visit, they really don't know what has happened to you across that quarter. But if they had access to patient-generated health data from your glucose monitor and they got that data, they could begin to look at, you know, what happens across every day rather than just that day, and maybe give you some different advice about how to manage your health care and how to look and deal with where you have spikes or where you've had problems, what kind of corresponds with that, what could you do differently to modify your lifestyle to make sure you don't have these fluctuations in your glucose readings. Number 6, will you and the care team recognize health and healthcare goes beyond the walls and provide care through these different digital tools? This is going to be particularly important to those millennials who don't want to have to take a half a day off from work just to go see a primary care provider. They would rather sit down with their smartphone and have their 1-hour visit. Will you and the care team connect me to other patients, resources, and evidence-based practice so I can be more informed about my decision making? Will you and the care team help to transform the way I experience healthcare and how that healthcare can be delivered? Will you and the team provide personalized care that's based not only on clinical data but includes social and behavioral measures as well as patient preferences? And last but not least, will you help me understand my health data to make better decisions? So this is where I think that we need as educators to begin to open up the world to our nursing students and to staff nurses in practice about connected care and where we are going in the future and how informatics specialists can really help you in your organizations to utilize the digital equipment to provide the best and safe care for your particular patient population. So I want to thank you, and I will look to see what kinds of questions we might have.
Well, thank you, Dr. Skiba. This is Marge Riley again. You've given us lots of things to consider and think about and reflect upon, always provocative. I recently had the experience that you talked about with patient-generated health data this past weekend, visiting a colleague and friend in a major medical center here in the New York City area, and pulled up on the smartphone the most recent labs that the patient had drawn that morning, and we were able to look at them, examine them, and then prepare questions that we were going to pose when the doctor came around to speak with my colleague. So that was one example. Another example about using digital tools, some of our students here at the School of Professional Studies nursing program were engaged with one of our clinical partners to bring the information to the patients, as you say, in a new format. The idea being that the initiative was focused on health literacy, and they used iPads and had the students work on developing an iBook to educate the patients as they were in the waiting room about different things that they needed to know about their particular ailments and illnesses. So those are really good examples that you brought forth, and again, to talk about actually being utilized in the clinical settings right now is a really important thing. A couple of questions that came to us here that were posed to us. You mentioned questions, very thoughtful ones, about nurses considering how to prepare themselves for this new environment. How can schools of nursing or other healthcare professionals prepare themselves for professional being able to practice in this new kind of environment? What kinds of things would be good for programs to look at, curriculums to consider?
Well, I think, you know, there's a lot of information out on the internet, and there are a lot of organizations that are putting things forward, particularly around connected care. There is a Center for Connected Care that's out of the Boston area, and they have a lot of webinars, they have a lot of handouts, they have a lot of materials that are accessible to people. I think you're going to see more conferences out there where people are going to be talking about connected care and using this. The Institute of Medicine has quite a lot of information about consumer-facing tools, and they did this as part of their health literacy series. And so the information that is accessible through the Institute of Medicine is all there. So all their presentations, any links to tools, any reports that they've written are freely accessible to people. The VA, as I've mentioned, has done a tremendous amount, and just, having access to many of those mobile app tools and, many of the videos and different things that they're putting out about connected care can easily be used for educational purposes. And, having them come in from the different VAs to give presentations to your students and demonstrating how to do that would really be, ways that you as educators can bring that information into your system.
Great suggestions, thank you. Another question that came up had to do with the growing geriatric population. And what has been your experience in terms of promoting digital access to health information with that particular population? Are they embracing it? Are there tools and strategies that can help make it more acceptable to members of this population group who might not feel so comfortable with digital tools?
That's a great question, and I think that's one that there's new research that's coming out, as we speak in terms of looking at this. I will tell you from talking with AARP, they have made connected health a mission of theirs. And so they have really been doing a lot to provide different kinds of opportunities, not only to talk about how to use it in their healthcare, but they've actually developed a tablet that's a little more user-friendly that the seasoned population can use that don't really want to buy a computer. We also see that there have been several research studies that have looked at different ways to do some training and to do some engagement with that particular population. And what they're finding is that the older patients who have kind of grown up in a non-computer world and do not feel comfortable with that, they have found that their family members or their caretakers become the ones who get engaged in really utilizing the tools. As you look at the younger elderly, if you will, sort of those that are, if you think about 60 to 70 something, many of them are much more comfortable. What they truly need is someone to sit down and to engage them into using it. And so one of the small studies we did was if we sat down with people and showed them how to get online using their cell phone or their tablet and getting them logged in and showing them where things were and how to click around it and where to look for things, we found that there was a greater likelihood that they came back in and
That's
that they would
interesting.
begin to use the system. But if you tell them, if you hand them a brochure and say you can get access to it, they don't do it.
Right.
They need that extra step.
So
I can
a little
tell
bit
you
of the
from
personal touch.
it is, and I think that's where we've got to do more work with the providers. They don't have to be the ones to do the teaching, but they need to sort of push it in their system that we need some people who are available and accessible to help people get on, as well as they need to be promoting the idea that they should connect in.
And then once they get used to the idea, they're more likely to use it again.
You bet. I mean, I think it's a great place that we can have our students do some training.
Well,
You
that's
know?
actually the health literacy project that our students did. They
Yes.
literally sat in the waiting rooms and went through the iPads with the patients and helped them learn how to access it and navigate it, and found a good response with that as well.
Oh, I
Um,
bet. I think that's a perfect example of how, you know, agencies can utilize that. I have to tell you from a personal experience, I had my cancer journey, and while I was in the infusion center for my chemo injections, I got friendly with what we called the Monday morning crowd. We were all there. And I would say the majority of the people that were there were older than I was, and they all had smartphones. And
Interesting.
so one of the things that I did every infusion is my goal was to at least train 3 to 5 people during that time frame. And I swear the nurses were ready to kill me some days because they couldn't find me, you know what I mean, because I was kind of going up and down the the infusion center, sort of asking people if they would they be interested, could I show them, let me show you mine, and, you know, we can get you logged in so you can do this.
Wow, that's great. Sharing
But
your
I think, you
expertise
know,
even then.
I think I think people are willing to do it if they've got that little personalized touch.
Yes, great idea. I know we're winding down here, so we have one last question that we hope that you'll be able to respond to. There was a question about what are your thoughts regarding the interoperability
Interoperability.
of all these devices?
That is really still a concern. And I think that the federal government, the Office of the National Coordinator, has really put that as the #1 thing that they are pushing. Right now we're looking at getting public comments about the interoperability guidelines that they're putting forward, because they really want to push that we have interoperability between personal devices as well as, you know, hospital devices, and making sure that we can do all the interconnections. So from a technical aspect, I would foresee in the next year or two we will have a lot more of this figured out. A bigger problem is going to be how we do what we call semantic interoperability. You know, we all call things differently. So a patient might refer to themselves as having high blood pressure, but the provider calls it essential hypertension. So we've got to kind of have some mapping that needs to happen in the background to make sure things get matched up, so that, you know, the patients and sort of what they're thinking and how they're using terminology matches up with the terminology being used by providers, which, you know, even the providers can't agree on terminology. So I think, well, that'll take a little longer to get that semantic interoperability, but I would project as we look at the technical piece of it, that interoperability will happen quicker.
Well, thank you very much again for your time today, for your wisdom. Great topic, a lot of things for us to think about and consider. We appreciate your presenting this as we host here at the CUNY School of Professional Studies Nursing Program, and I want to thank Dr. Diane Skiba for her expertise and sharing informatics in a connected healthcare environment today. Those of you who have registered for today's webinar, we do have some slides that we'll make available to you, and we will do some editing and make the recorded session available to you as well. Thank you again, everyone, for all of your time, and thank you again, Dr. Skiba.
Thank you so much, Dr. Riley, for inviting me, and have a great day. Thank you.